first we're going to start with the metabolic part. And what else than metabolic acidosis? Okay, so now the thing, and you can get a question, tell me examples of metabolic acidosis. And now I'm going to really use the agap, that's why we were talking about it, to divide it into 3 groups. And as I said, the first group is with decreased agap. This is rare. And basically over here, for example, the decreased agap could be due to, as I said, it's if there is lots of paraprotein, so multiple myeloma, remember. And this is very special because sometimes the proteins, they can have also positive charge and whatever, and this mixes the whole thing up, and that's why, or basically, yeah, it really, they're totally atypical proteins, and it sort of changes the agap, okay? Yeah, and you don't have to know about this at all, but it's decreased agap, okay? And then but the ones you should know are the ones I mentioned, and those are with the normal agap, plus minus 12, and with normal agap you should remember the diarrhea. Okay, so you're losing bicarb, and that's why agap won't change, so bicarb. And the other one is renal tubular acidosis. And there are many types of renal, but maybe I would like you to know 3 types. Okay, and in this case, the agap will not change, and you should remember first type, but watch out, first type mean that the problem is distal, in distal tubule of the nephron. And normally in distal tubule you resorb, or you excrete H+, okay? So there's a H+ excretion, and you can have mutation or whatever the cause, and there's a problem with H+ excretion, okay? And in this case, you are retaining H+, and that's why you are acidic inside, okay? So acidosis. And moreover, because you are retaining sodium, guess what the urine pH is going to be? It's going to be alkalic. pH is very alkalic. And remember, if you're having alkalic, you don't want to have alkalic urine. Why? pH is high in urine. It's over, and don't forget there are different normal levels. So when the urine is over 5.4 pH, it means that it's already alkalic. Okay? So what does it mean? If you're having alkalic urine, then you're going to form stones, and this is very dangerous because you are forming stones all the time. Okay, so stones. So you got nephrolithiasis. Okay, and this is special with in this case. Okay, so remember, type 1, it's a distal problem, and you are having nephrolithiasis, so stones. That could be very painful because if it blocks the ureter, it's a colic pain, severe pain, okay? And typically they have to pull out the stone, urologists, okay? So that's RTA1, or distal type, okay? So then you got RTA2, and it's a proximal type. And over here, it's not a problem of getting rid of H+. It's a problem of retaining or resorbing bicarb. Okay, so the resorption of bicarb and the proximal part is failing. That's why you are losing bicarb. But believe me or not, after a while you pee out the whole all amount of bicarb out of your body, so you're losing bicarb all the time. And at the end, if you don't have bicarb in the urine gets acidic. So over here, you don't have to be afraid of, so you pee out all the bicarb, and you don't have to be afraid of stones. So no stones over here. But again, in the body, you got acidosis without any changes of agap. Okay? And the fourth type, we will forget on the third one, ATA4 is about, this is not a problem in the kidneys itself, but you should remember Addison's. And that is every time you don't produce enough of aldosterone. So if you won't have enough of aldosterone, you will not get rid of H+, okay? And if you're not getting rid of H+, it stays in the body, okay? So remember, every time you have a problem with secreting aldosterone, you're going to have also acidosis, and it's called although it's called renotubular acidosis, basically the problem is not in the kidneys themselves, but with aldosterone, okay? And in contrast to these two, over here, potassium is going to build up as well. Okay? In Addison's, remember, K+. Over here, potassium is going to be decreased over here as well. Okay? So, but I told you much more about RTA because it's an USMLE test, and I'm sure many of you want to pass USMLE. But we don't test this so much over here. Okay? We only want you to know the types. So remember, all of them cause acidosis. You should know first, second, and fourth type. And remember, it's the opposite. The nephron, when the urine flows in a nephron, first it gets proximal and then distal. But the names are the other way, numbers. So distal type is type 1, proximal type is type 2, and fourth one is Addison's, for example, or any case where when there is decreased aldosterone, okay? And all of them cause metabolic acidosis without any changes in the agap, okay? And let's get to the most important ones, and those are the metabolic acidosis with increased agap. So now we're heading to metabolic acidosis, but with increased agap. And as I said, these are the ones when there is a buildup of something like a waste product that shouldn't be normally high in your body, like lactate or ketones, or you're drinking some acid or whatever, like ethylene glycol or alcohol or whatever you want. Okay, so I'm going to name them, but the first that you should understand or remember is the lactate. So lactate. So again, when there is buildup of lactate.
Hypoxia.
So as we talked about, hypoxia and ischemia. So every time you're losing pressure and there's decreased perfusion, so hypoxia, ischemia, okay? Every time you're getting into shock, circulatory shock, you're going to have lots of lactate, okay? Also when you're suffocating or whatever. But when you're suffocating, you're going to have two problems, okay? When the O2 is decreased. When the O2 is decreased, you're going to have metabolic acidosis. And what are the change? If you're suffocating, you're hyperventilating, so you're going to have definitely metabolic acidosis plus respiratory acidosis as well. Yeah? Okay? Yeah? Because you're hyperventilating. You're not getting rid of CO2. Remember that, okay? Just an example. But now we're doing lactate. So when you're hypoxic or There's less of oxygen in the air, but you're able to ventilate normally, and only the oxygen is decreased, CO2 is not increased, then you're going to get rid of CO2 easily. Okay, and that's why the CO2 won't be increased. You're going to rather get rid of it. And typically that's why if you, for example, first have lactate increased, you're going to compensate it by hyperventilation. Okay? Yeah? Get it? Yeah? So if I'm losing blood and I'm getting into shock, first I'm having buildup of lactate, I'm having metabolic acidosis, and I'm going to hyperventilate to it to compensate that. Okay? But if someone strangles me, I'm first of all hypoventilating. So there's decreased pressure of O2 and increased CO2. So that's respiratory acidosis. And because there's decreased O2, I'm going to produce lactate as well. So combination of respiratory acidosis and then very soon metabolic acidosis. We're up here. Okay? Yeah? Good. So, but now it was only lactate. And as an example, what about ketones? You told me already. So it's diabetes mellitus first type or starvation. Okay? The two main ones. Well, and now intoxication with many things. And for example, aspirin, it's an acid. So and also it poisons your mitochondria a bit. So you're going to definitely have metabolic acidosis. But watch out. This is so special, and this is many times in USMLE straight. We don't know the mechanism, but somehow aspirin as a drug is able to stimulate your ventilation just a bit. So you are just a bit hyperventilating, but as a function of the aspirin, not as a reaction to metabolic acidosis. So you're breathing a bit more than just a compensation. Okay. So typically, aspirin does combination of metabolic acidosis plus respiratory alkalosis. Okay. Yep. Remember that. It's a special feature of aspirin. Methanol, ethanol, so that's alcohol, and ethylene glycol. Ethylene glycol you put in the cars if you don't want your car to explode by ice in winter. You put there ethylene glycol, and unfortunately many people also drink it and they're dying. And the one thing they have is metabolic acidosis with increased agap. Okay? Yep. Okay. So these are examples of metabolic acidosis, but you should know lactate, ketones, aspirin, methanol. Okay? Yeah? So that's metabolic acidosis. Respiratory acidosis. And that's pretty simple for you, because as I told you, you can say one word, and that is hypoventilation. Okay, so this equals hypoventilation. And there are many reasons, and we went through many of them. So COPD, restrictive diseases, Okay, so restrictive, that means pneumonia, lung edema, pneumothorax. Okay, there are many other, like kyphoscoliosis is the most common cause of restrictive disease, because when you're getting older and your vertebrae are collapsing, the chest, when you're 80, the chest, you're not able to expand the chest, so the chest restricts the lungs to expand. Okay, so kyphoscoliosis, most common cause of restrictive disease in elderly. Okay, in old patients. So and of course then other causes, as we talked about, asthma, suffocation itself, strangulation, whatever you want. And of course, central nervous problems. So it could be some let's say, plegias or whatever of the phrenicus, or so it's neuropathies. And if you have problems with muscles that the diaphragm cannot contract enough, so neuropathies, and whatever that happens to lungs in a way. And don't forget, if you're obese, because if you're obese, you're not able to expand the chest again, and you are having respiratory acidosis. And not only obese, and you don't have to be obese, but mainly you are. Also, don't forget obstructive sleep apnea. If you're suffocating in the night, okay? You're snoring, and then your airways will collapse, and you're having a pause. Okay? So sleep apnea pause. You have apneic pause, okay? You don't sleep well, you are in stress, you have pulmonary hypertension, remember that. And also, I'm sorry?
What's the green word that you wrote?
Kyphoscoliosis. So kyphoscoliosis. That means you are like bent, the old people when it means scoliosis in kyphosis especially. So kyphosis means it's exaggerated and you're bent like forward. So the chest collapses. Okay, yeah.
Great, thank you.
Good. So remember, most common cause of restrictive disease in old patients. So you got many causes, and don't forget also opiates. So if you're intoxicated, you won't breathe enough, and you're going to get into respiratory acidosis. Okay? Very good. These are examples of respiratory acidosis, and let's get to another one. And now we're getting to metabolic alkalosis. And you know the causes. So first of all, I'm losing H+ by vomiting or nasogastric suction, as I said. Okay, if you're vomiting, why not? Or you're not getting enough of chloride, like intake. Remember the ion columns again. If chloride gets decreased, bicarbonate expands, and you're having metabolic alkalosis. Okay. Or, so intake, for example, chloride intake. Then diuretics, in a way. So anytime you are having hypotension, and that could be due to diuretics, or you are losing blood, or you are dehydrated, what system is triggered? The RAA axis. And every time you get lots of aldosterone, and aldosterone is getting rid of H+. So every time RAA axis is triggered, you are having metabolic alkalosis. Remember that. Okay? In shock or whatever. Okay? And also you have not a reaction to hypotension, but you have autonomic production of aldosterone, which is called CONS. And CONS is an amazing example for you of metabolic alkalosis. Yeah? Lots of aldosterone. So you just mention it there. Okay? So that's CONS. And remember also cortisol can have this effect. If there's lots of cortisol, you're going to get rid of H+ as well. And also licorice, that's in USMLE again, licorice. If you eat too much of licorice, it has the same effect as aldosterone. So you're going to have metabolic alkalosis. Okay? So that's metabolic alkalosis. Okay? Or you can drink lots of, milk, and you can have alkalosis. Okay? Yeah? So alkalic. But we don't see this anymore. And last one is respiratory alkalosis. And the synonym to this is hyperventilation. And typically, if you're fine and now you start to hyperventilate mandatorily, or you're trying to inflate something and you breathe a lot, you're going to get dizzy and you can faint. Remember that. And this is typical. If they get excited, there's someone comes to the podium and they start to yell, so serious yelling, severe, is actually hyperventilating. You're getting rid of CO2 and you can faint. Watch out. Okay? So typically, if it's a healthy person totally, and it's not compensation of anything, I mean compensation of metabolic acidosis, but you just artificially start to hyperventilate, then solution how to prevent fainting is breathing into a plastic bag. Remember? So that's typical at concerts. Okay? So respiratory alkalosis, it's of course it could be compensation to any kind of metabolic acidosis. So as a compensation, I'm going to hyperventilation. But I can hyperventilate on my own. So inflating somewhere, breathing too fast artificially, and also, for example, remember the aspirin, okay, as I told you, or progesterone. Typically, pregnant women hyperventilate a bit thanks to progesterone, okay? And of course, a reaction to what? To hypoxia. So in case I'm going to breathe air which has a lower partial pressure of oxygen, which is every time I'm climbing somewhere, okay, or if there's a lower partial pressure of oxygen in the room, by whatever the reason, but typically when you climb mountains, like if you go over 4,000, you will immediately hyperventilate. And the trigger is decreased levels of O2. So you are trying to catch up with decreased partial pressure of oxygen in the air. And as a result, you blow out too much of CO2 and you are hyperventilating. Okay? Yeah? So you're going to hyperventilate. Mountains. Okay? Every time you go too high on Mont Blanc or wherever, you're going to hyperventilate over there. Okay? So, now you know the examples of respiratory alkalosis and respiratory acidosis. Also remember, at the IC units, it's always important how you set the ventilator. And you can very easily hypoventilate someone with a ventilator or hyperventilate them artificially. So ventilators, don't forget as well. Ventilator. Okay? So, and last question. We're going to have respiratory acidosis here, metabolic acidosis, metabolic alkalosis, and respiratory alkalosis. Now, and what I want you to tell me is, if I'm now having respiratory acidosis, which could be COPD, I'm having COPD, or suffocating, can it be combined with metabolic acidosis? So basically, question is, can I combine that? Yep. Can I be suffocating and at the same time having diabetes mellitus decompensated? Yep. So this can be easily combined. Can I combine metabolic alkalosis with metabolic acidosis? So can I have diabetes mellitus and at the same time vomit? Yep. Can I hyperventilate by, I don't know, I go to mountains, and can I have metabolic alkalosis? Yeah, I can vomit over there, so why not? Can I hypoventilate and vomit? Very likely. Can I hyperventilate? I'm excited and also, let's say, having diabetes. And can I hyperventilate and hypoventilate at the same time? No. So watch out. You cannot combine respiratory problems. Either you are hyperventilating or hypoventilating. But with the metabolic, because there are many causes of metabolic problems, kidneys, diarrhea, vomiting, of course you can combine them. Okay? Yep. So, thank you very much. Okay? And see you soon. So, thanks for watching. And don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.